Dua. Dr. Dua is a professor of medicine and professor of medical education at the Icahn School of Medicine. She received her medical degree at the Maulana Azad Medical College in India, followed by residency and chief residency of internal medicine at the Good Samaritan Hospital at Johns Hopkins University. She completed her fellowship training in pulmonary disease and critical care medicine, followed by lung transplant fellowship at the University of North Carolina at Chapel Hill. She is currently the fellowship director for the pulmonary and critical care medicine training program here at Sinai and the medical director of the Fellows Clinic. She's also the faculty development facilitator for the Institute of Medical Education, as well as a director of the GME Wellness Champion Program for the Mount Sinai Health System. Her clinical interests focus on interstitial lung disease, and her medical education interests include trainee wellness, small group teaching, delivering effective feedback, and teaching in resource poor settings. She serves on education and training committees for several national professional societies and travels yearly to Africa for medical education missions. She lectured both extensively locally and internationally in the area of medical education, and her work has been recognized by numerous teaching awards and as a fellow of the American Thoracic Society. Her talk today is titled Giving Effective Feedback.
Great, thank you, Pranay. Such a trip to hear your own introduction, and especially by a former fellow. So thank you for doing that. With that, I'm gonna go ahead and share my slides. So give me a thumbs up, Pranay, if you see everything okay.
I think we have, yes, there we go.
We're good, right? Okay.
Yeah.
All right. Welcome everyone to ICCM Grand Rounds. This faculty development module on giving effective feedback was actually developed in my role with IME. And I will tell you upfront, I make no money out of this, unfortunately, no conflicts of interest. But the idea for this session, and the good news is it's a pretty short module, so you'll be done way before 2 o'clock. But the idea is that you should be able to understand evidence-based principles of giving effective verbal feedback to your trainees, and then develop an efficient method to set expectations at the start of a learning relationship, because it is really not fair to have feedback conversations without ever having set expectations in the beginning. And finally, I will give you a framework for giving you a timely, effective feedback kind of template to use that you can use no matter where you are doing feedback. So with that, let's have a quick self-reflective exercise. Do you regularly set and share expectations about feedback with your trainees at the start of your learning relationship? And do you regularly provide face-to-face verbal feedback, either individually or to your entire team? So think about this as we go on. So how are we doing with feedback? Let's give you a little background on, say if you were to take medical students who are MS3 and you were to ask them what kind of feedback they have been getting, you will notice that it doesn't matter whether it's residents or faculty members, a majority of us are giving encouraging feedback. And that in itself is not a problem. The problem is a majority of us are also giving non-specific feedback. So feedback loses its efficacy when it's non-specific. In fact, only a third of us, no matter whether we are faculty or residents, when we're giving feedback, very few of us are actually giving corrective feedback, and less than a quarter are giving specific feedback. So I'm really already setting the stage for you to let you know what effective feedback is or isn't. If it's just merely encouraging and non-specific, it's not effective. It has to be corrective and specific for it to be effective. And so I don't expect you to read any of this because this is all like surgical nonsense. However, what I really want you to focus on is to be considered effective. Yes, you should be encouraging, never a problem. But please be corrective and specific so that if you're only giving kind of non-specific feedback, you're giving mediocre feedback. And if you only do encouraging and non-specific, which by the way, most of us are very guilty of doing, this is considered ineffective feedback. And so kind of feedback that looks very, very familiar to all of us would be, you know, you will excel in every field, you're hardworking, you function well on the team, you ask good questions, you are engaged, you are proactive, look forward to working with you again, you show interest in understanding concepts. Oh, my favorite, keep reading, keep practicing procedures. So some of us are doing this a lot, and yes, it's encouraging and that's great, but it is so non-specific that this particular feedback actually is ineffective for our trainees. So then what does it take to give effective feedback? Well, first of all, you have to observe your trainee. Then you have to plan giving feedback, practice giving feedback, because it's almost like muscle memory. You will only develop it if you do more of it. And then be flexible in the way and when you deliver it. So you can imagine that a lot of us could be doing a lot more of feedback conversations, but we're not. Why? Because we have a lot of barriers to effective feedback. And I will not just leave you with the barriers, I will offer some potential solutions as well. So as all of you could have imagined, by far, the biggest problem and barrier to effective feedback is time limitation. All of us are so crunched for time that the first thing that goes out the window when you're having a busy day is feedback. The second could be, I actually have my pulmonary critical care fellows with me for 3 years, and I feel resistant to giving negative feedback because I don't want to ruin my professional relationship with them for the next 3 years if I give kind of a negative feedback in my first time together with them, because I don't want to be awkward among us for the next 3 years. Also, I have no idea how my trainees are going to perceive me giving negative feedback. So I feel like my trainees don't really want to hear negative things about themselves. And finally, I might be overwhelmed with what I need to address during my feedback conversation. Like, I don't even know where to begin, right? So if you have time constraints, remember that the idea starts with establishing a culture where feedback is not only just expected, it's desired. In fact, your learning relationship together should not come to an end without having had a feedback conversation, because it is an essential component of teaching. So if you are going to bother teaching, you're going to bother giving feedback. That's how the culture should be. And several years ago, our fellowship program came under review because of deficiency of feedback. That's when we started really making sure that a learning relationship between faculty and fellow will not end without having had a feedback conversation. And yes, I am that annoying program director that will send weekly reminders to my fellow and faculty pair to make sure a feedback conversation has occurred by Friday. Okay. Now, if as faculty member, I feel reluctant about giving negative feedback, remember, as long as I ground my feedback in observed actions and decisions, right? I observe somebody do this, act like this, say this, then there is no need to have resistance regarding giving negative feedback, because I am not giving you feedback regarding your personality or your personal attributes. I'm giving it on what I observed in terms of your actions and your decisions. Now, if I think my trainees are resistant to getting negative feedback, I engage my learners as an ally in self-reflection, okay? And I'll show you how our template works for self-reflection. And then finally, remember, feedback is something that is best consumed in small portions rather than a banquet. So if you're feeling overwhelmed on what to address, just address little things at a time. So it's much better peppered over your week together rather than one giant conversation, okay? So here are my potential solutions that I offer to you for all the barriers that we have. So what exactly is feedback? Let's define this. Now, every single word in this definition has significance. A, it's a supportive conversation. So already I'm telling you it's two-way. Now, unlike the webinar that I'm giving right now, which is very one-way, it is a supportive conversation that clarifies the trainee's awareness of their developing competencies, okay? So already you are using a trainee as an ally in self-reflection because their own insight into their developing competencies is being highlighted. Next, it enhances their self-efficacy for making progress. So even though feedback is about the past, you're really feeding forward about their future. Remember that. Then it challenges them to set objectives for improvement. So really forward-looking and forward-thinking. And then it facilitates their development of strategies to enable that improvement to occur. So it's not just you telling them what you observed regarding them in the past, you also giving them strategies for improvement for the future. That is what makes feedback. And that's why it's a supportive conversation. Now, let's also make it very, very clear what feedback isn't. And most of my faculty members actually confuse feedback with evaluation. They're not the same thing. First of all, feedback is formative, whereas evaluation is summative. Okay, what do I mean by that? Feedback is something that you make an assessment of your learner for their learning. So I'm already telling you, even though it's feedback, you're feeding forward for their learning. Whereas evaluation is something that you summatively did, assessment of their learning, whatever have they achieved in your time together. So when you're filling out your evaluation forms, you are really, really looking backward, okay? Now, feedback presents objective information to help learner improve relative to themselves. What are you comparing them to themselves? So when you're giving feedback to somebody, the comparison is to their own self. Whereas in evaluation, you present a judgment about how well a learner met a goal or a standard or an objective for that rotation. So that's judgmental, whereas feedback is objective. Now, in feedback, you will use neutral statements that have a lot of verbs and a lot of nouns. I observed that you made this decision. So a lot of verbs and nouns. Whereas in evaluation, you say normative statements. There's a lot of like summary judgment that you put. You put a lot of value judgments to what you write. So it's full of a lot of adverbs and adjectives. You know, this learner met the goals, meeting expectations, exceeding expectations, all those adjectives that you use, that's evaluation. Then feedback is typically very focused, whereas evaluation is quite comprehensive. And if you forget everything on this table, the last thing to remember would be feedback is something that occurs day to day, whereas evaluation occurs at scheduled intervals, right? So if you wait too long, it's no longer considered feedback. If there's something especially serious that you really need to address, if you haven't had a feedback conversation in the next 24 hours, it's no longer effective feedback. It has to be something that's done in a timely fashion. So just to summarize this portion, feedback is information you give to somebody in the moment. So don't wait too long. Whereas evaluation is summative information that is based on multiple data points along the way. So I hope everyone's clear that feedback and evaluation are two completely different concepts. Okay, so let's go on with setting expectations. As I said, it is really not fair to expect feedback to become part of your work culture if you didn't set expectations at the start of your learning relationship. And therefore, this is how you do it. And this is, again, those annoying program director emails that I send out to my faculty and fellow pair every Monday is to make sure that they're setting expectations at the start of a learning relationship. So when you start your rotation with your faculty as a learner, you should have this expectation conversation with them. And you as faculty should be reaching out to your learner. And this will take, I promise you, no more than 2 to 5 minutes on a Monday morning when you start. So what do? You start with saying, this is a safe environment, and I expect that all of you will actively give and receive feedback from me and each other. So if you're talking about a team, especially in the ICU. Then when you are with your learner, please elicit their goals from them. You know, what feedback have you previously received? Because what is it that you're actually trying to work on so that you don't get overwhelmed with everything you should be addressing or observing them on? You can say, in terms of moving forward in the next week that we have together, what changes were you hoping to make so that you can actually focus your observation? And then finally, please share what you expect from them. It is really not fair for us to expect our trainees to mind read us. Okay, we have to lay down our expectations very clearly. When I start with my fellows on a Monday morning, I will usually text them on a Sunday evening. Hey, I want you to have pre-rounded on the list of patients, you know, whatever, top 10, I usually say top 8 sickest patients, most active patients, whatever, when you meet me for consults, because I don't have the same work style as another faculty member might. So obviously you must be always feeling free to share skills that any kind of learner should have for their specified roles. During this week or day, whatever, together, I expect you to. And at the same time, you can also tell them, I will not be available from 1 o'clock to 2 o'clock on Thursday because I'm giving grand rounds to ICCM. So please don't be texting me or calling me at that time. So really make sure that you've set your expectations of the day or the week with your learner at the start of your learning relationship. Then moving to the actual meat of the matter, feedback being a conversation, I will show you a model that you should all be using to do your feedback conversations. Now, going back to the model, you should not be using, remember this old feedback sandwiches where you would basically sandwich the constructive criticism in the middle of two very positive comments. So, on the whole, things were fine, but you were not so good at this. Generally speaking, everything is good. So this feedback sandwich is no longer utilized. Why? Because it makes too many assumptions. So really, when you do a traditional feedback recipe with that sandwich, the assumption is that the teacher, you, is appraising performance. Then you're providing the appraisal data to your learner, and that the learner is using that data to improve performance, right? But the assumptions that are being made is A, that your appraisal is accurate and that you made direct observations, which sometimes you may not have, okay? And the second assumption is that your feedback is actually getting accepted by a learner and getting incorporated. So given this limitation, we no longer use that feedback sandwich. A better feedback sandwich is called the ask, tell, ask. Why do we use it? Because it's more learner-centered, it's active and interactive, it avoids assumptions or judgment, and it promotes self-reflection on part of your trainees, okay? So they become an ally in this. Ask, tell, ask. So the first ask. Always start the feedback conversation, first of all, by saying, this is feedback. I can't tell you how many studies have shown there's a discrepancy between faculty and trainees thinking how often feedback has occurred. So when you do the first ask, why you do it is because it begins a conversation. It gives you an idea of the learner's level of insight. So the idea of where the learner thinks they're at, and it promotes their self-reflective practice. So how would you do this? Always start with asking, how do you think that went? Okay. For me, on Friday, when I do a feedback conversation with my PCCM fellows, I always lead with, how do you think this week went together? Okay, if it's for just a clinic encounter, that may be true for some faculty. How do you think you did during that encounter? Or it may be, in the ICU with a family meeting or with a procedure or with, case presentation. And how do you think you're doing this week? So this is your first ask, okay? Always start with asking your trainee how they think they're doing. Next, you have to tell. Now, when you tell what you observed, the first thing you have to do is actually react to what your learner just told you, okay? Normalize what they just said, and then you do your tell part. And that tell part would be you using descriptive but non-evaluative language. So you will be specific, you will avoid generalization, you will only tell them what you saw, that you observed in terms of their actions or their decision, and not make comments on their personality or personal attributes. So first thing you want to do when they said something to you would be to normalize it. It is common for interns to struggle with efficiency in July and August. Say your trainee said, oh, I'm so sorry, I never got the notes for you to co-sign on time. I took too long to pre-round and hence rounds were too late, or I didn't feel I was prepared with all my chart checks because I'm not, time managing well. So just react to their observation and normalize it. And then you dive in with, I observe that. Always lead with, I observe that, because you will be specific, you will avoid generalization, you will use descriptive and non-evaluative language. So just to give you a pulmonary example, you be very specific. If I feel that your history is lacking some detail, I want to tell you exactly what detail is lacking. You didn't ask about vaping versus saying your history was incomplete. So be very specific and avoid generalizations. So if you're struggling of how to anchor your tell, remember, you can always relate to those 6 core ACGME competencies. Now, these are the milestones that we measure our trainees on that whole autonomy versus supervision spectrum. So you can basically anchor your feedback. Like, what if I have a superstar fellow that I literally have nothing to say? I can always find something to say. Why? Because what I can do is anchor my feedback to one of those 6 competencies. Whether it's, say I couldn't find anything to tell them about their patient care or medical knowledge, I could always use their practice-based learning and improvement. Did they know literature well? Did they have scientific evidence for those recommendations they made? Were they using, standard of care kind of guidelines, etc.? Or you could always give them feedback on their interpersonal communication skills, how they're speaking to our consultants, etc., or our ancillary staff. On their professionalism, were they timely, or were they ready for all the presentations? Or systems-based practice, like how did they negotiate patient care throughout the healthcare system? This would include discharging from the ICU, transferring to and from the ICU, dealing with the ER. So all of this you can use as an anchor to give your feedback on, especially if you're struggling on what to address. And then final part of the sandwich is going to be ask. You are going to, just like we do with our patients sometimes when we give them instructions to repeat back, you're going to ask for your recipient's understanding of the feedback. And then you can also ask about potential strategies for improvement. So even though your feedback, you are feeding forward, right? You'll develop an action plan because you're taking off your faculty hat and putting on your coaching hat. You're becoming a coach now. And then you're going to commit to monitoring movement together. So how? What could you do differently next time? This is your ask of them. Or can we check back again in a week if you have a longitudinal relationship with your trainee? So depending on your learning time together, always feed forward what they could be doing better. Okay, the one thing I'll be remiss if I didn't mention was a lot of times our race biases can creep in when we're giving feedback. There are studies here that have shown that if you were to take a trainee who's an underrepresented minority in medicine, the words such as pleasant are much more likely to be utilized. Whereas if we're a non-URM trainee, the word knowledgeable is more likely to be utilized. So just be careful that you're checking your own biases when you're using language to give feedback to trainees. The other would be the gender bias, because a lot of time women trainees are more likely to be called lovely, whereas men trainees are more likely to be called scientific. So we have to be very, very careful in our lingo that we're using with our trainees to make sure we check our own biases. So I want to leave you with tips for effective feedback. You can screenshot this slide because this is really the whole gist of the matter. First of all, you're going to have to set an orientation and climate, because remember, be appropriate in where you give feedback. If it's confidential feedback, you shouldn't be doing it in a corridor. You should be doing it in an office. Back in the pandemic days, we didn't stop doing feedback. We just did it on Zoom. Now we do it in person. So select your time and place, a relaxed atmosphere, and make your agenda for your feedback. Then you launch into your ask. This is you eliciting from your trainee. So this is the first part of the sandwich, which is where you ask for your learner's perception on how well things went with your time together. Then is your tell part, and always lead with I observed that. Okay, you make it very objective, very specific, avoiding generalizations. So this is you giving your actual diagnosis of your learner and giving them feedback. Please place it in the context of their goals, okay, after you've responded to their own observation, because it really tells you where they're at with their own insight on where they're located. Then the next ask is you asking for learner suggestions about what improvements they could make next time. So what would you do differently next time? Or how could we improve upon next time? And then you give your suggestions. I would say this ask should probably also include asking them what you could be doing to improve your faculty teaching efforts. Like, what is it that I'm not doing that I could be doing so that our learning time together is more fruitful for all of us? Okay, so yeah, Dr. Dua, you didn't blah, 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 blah. You can tell me that. So I actually asked for 360 because that's the asked part also. And then finally, as you know, you're going to apply to future problems because when you have longitudinal relationships, this learner is going to come back around and will have incorporated feedback from your prior time. And there's nothing better for me than seeing that when that happens with my fellows. They solicited feedback, they heard me, they incorporated it. And when I saw them the next time around for my learning relationship together, that problem was solved. So that's really useful. And then finally, we can review the specific consequences of this behavior change. So final tips I want to leave you with is good feedback has to be frequent. Don't wait too long and don't make it infrequent. It has to be timely. If it's more than 24 hours after you really need to address something, it's no longer feedback. It is balanced because you asked for their opinion, you told your opinion, and then together you asked again of what we could do improvement-wise next time. Remember, good feedback is specific and allows your learner to self-reflect. And then finally, in person, be very conscious of your non-verbal communication. Remember, your body language could be giving unintentional feedback. So make sure that you are conscious of the way that you are positioned when you're giving feedback. So finally, you know that as faculty members, you are not going to escape having to do evaluations. So you're going to be asked to provide a summative evaluation for your learners. This is usually your end of the block together evaluations. Please make sure that you align what you write in your evaluation with the feedback conversations you've had. I can't tell you as a program director how many times when I meet my fellows for their 6 monthly evaluations and I go over their entire 6-month data, nobody has given them feedback around certain things that are written in their evaluation. So please do not do that to your trainees. Also, you did not give them a chance to improve if you didn't do a mid-rotation feedback conversation. So don't wait till the end of your rotation time together. Do a mid-rotation feedback conversation so that they have the second half of the rotation to improve upon the evaluations. And remember, your feedback conversation is really a feed-forward conversation because this is where you're going to give them specific, achievable next steps and give them a chance to improve their evaluations. So this is how you close the loop, by giving feedback which feeds your evaluation, okay? So just to conclude, what we said about giving feedback is, A, you have to set expectations. Align your and your learners' expectations early at the start of your learning relationship together. Remember that feedback is a two-way conversation and you are going to use the ask, tell, ask strategy to guide you. Always start with, how do you think that went? Then I observed that, and be very specific. Do not generalize, give examples. And then finally, what could you do differently? That's the last ask. Or what could I have been doing differently as a 360, okay? And then provide next steps as you conclude your learning relationship, because longitudinally, when that learner comes back to you, you will have seen what you have worked on together, okay? So these are the two resources I wanna leave you with. So one is a MedEd portal publication on a workshop. It's got a lot of different files in it, including a PowerPoint presentations by this physician. It's a workshop on giving, receiving, and soliciting feedback. Really, really nice publication. And then the second one is literally a 15-minute YouTube video on giving effective feedback. It's based out of UCSF's ER program. So I think it's very applicable to our ICU environment as well, with some really good examples of what's ineffective and what's effective feedback. So with that, I'm happy to take any questions. This QR code, please use it to give me feedback about my feedback module, which I will feed forward to IME for future development. So thanks very much. Happy to take questions in the chat box. I don't know if people can unmute themselves. Either way works. Told you it was a short one. And that's when I spoke slowly, actually. I have the chat box open. I don't see any questions in here.
Tom Tolbert is asking, how do you think your talk went?
Okay. You're using the ask, tell, ask model. All right. So I think I could have given specific examples that are probably more in depth and more ICU specific, but on the whole, I think I did pretty good, given that this is only my 100th feedback talk that I've given this year. Yes, Neha, very good question. So the question is, how do we factor in generational differences while giving feedback, Gen Z and millennials? This is very, very good because Neha, it is very true. When you and I were in our fellowship together, by the way, none of this was going on, okay? Nobody did the ask, tell, ask. Maybe they did the sandwich, the old sandwich, you know, the bad, good, bad stuff. But the truth is that this is the reason why this ask, tell, ask works better, because your first ask is making your Gen Z or millennial trainee into an ally of self-reflection. So having that insight that they have would be very useful. So this is where this generational difference actually helps a lot, when you always lead with, how do you think you did? Okay, so asking that is helpful. And the second thing is also, remember, being very specific, avoiding generalizations, giving concrete examples, and checking your own biases when it comes to race or gender. That is what our, Gen Z trainees are more sensitive to. So those are the two ways in which our generational differences matter a lot when it comes to giving feedback. Great question.
I can ask a question.
Go for it.
So I work predominantly at nighttime, and sometimes my relationships with the residents are very disjointed. Like I might have maybe one night with this team, and I won't see them again for like 6 months. Or I might have a total of 30 minutes with one patient, or one admission at all. So how can we sort of, like, it feels awkward to, like, for example, then have a full ask to ask discussion after like 15 minutes with somebody. Is there any way we can condense this, or?
Yes, you can. Absolutely. So, you know, that video that I showed you, this YouTube video thing, this is based out of ER shifts. So imagine that you're in that similar environment where you only overlap with your learner for that one shift, right? So at the end, at the beginning of the shift, you can literally spend 10 seconds setting the expectations that let's end the shift by doing a feedback talk. And that talk, by the way, the feedback conversation would take less than 1 minute. Okay, so over the course of your night shift with your trainee, you can ask at the setting expectation conversation is exactly what are they hoping to improve upon? You know, whether it's their patient care, medical knowledge, procedural skill, or whatever it be, case presentation, you know, you ask them, what is it the one thing that you would like me to observe you on for this limited time that we have together? And at the end of your shift, just do a under 1 minute conversation about how do you think that encounter went? And then I observed that, blah, blah, blah. And what could you do differently next time? So obviously your longitudinal relationship's not there. So you will not be able to reap the benefit of this conversation you've had, but you are going to leave your trainee with something specific to work upon. And this video, it's only 14 minutes long. You should watch it on YouTube, because this is highly, highly relevant to your question that you just asked, because they are all in the ER setting. They only do shifts, and they don't come back with the trainee over and over again. So it may be just a one-off thing. And even then, being very specific and giving them feeding forward information will be super helpful to their learning.
Thank you.
Yeah. Any other cues? I don't know. People are saying chat is disabled. Can you double check? Chat is disabled for some of them, but they can see the Q&A. Yeah. You have to, guys, you have to write your questions in the Q&A box, not in the chat. Yep. Okay, got it. Okay. All right, so here's the thing. If somebody wants a copy of this talk, I can send it around to Elba and she can blast it out to you all just so you have it for future reference. Because, you know, the more you do it, the better you get at it. So get cracking and get practicing. Okay, I see no more questions. Oh yeah, one more question. What are my tips for handling giving negative feedback if a trainee lacks insight? Yes, this is definitely a tough one where your judgment of how the trainee's performing does not align with the trainee's judgment of how they're performing. So it's quite possible that a trainee seems to think they're doing really, really well, and you are about to really like burst their bubble. So the best way to do it would be, again, adhere to the format. Of course, when you said, okay, how do you think you're doing? And they think they're doing really well, your tell portion is going to be very crucial here. But make sure you have specific examples, okay? Trainee hate nothing than getting negative feedback without specificity. So specific examples are very important. Avoid generalizations and make sure you always lead with I observed that, because you already are taking the pressure off of the trainee by taking the onus on yourself that I observed you doing this. But make sure that your feedback is grounded in observed actions or decisions or behavior, so that you're not commenting on either their personal traits or personality or personal attributes. So more like on what you observe them doing, saying, or making a therapeutic decision. And that way you can get around handling giving negative feedback. So specific examples is a gold mine. That's what you really need to be doing. Hope that helps. Okay. All right, if there's no further questions, happy to let you